All right, can everybody see my screen?
Yeah.
All right, so this is current and future projects of the TSRA. Just been reviewing some of the things that we've been able to put together. So we have a podcast that we've been able to make. We add about maybe 1 to 2 audio podcasts. It's usually an expert going over a specific topic. For instance, the 4 that is shown here are some of the more recent ones that have been added, and they go over coronary artery bypass graft conduits. We go over cardiac myxoma, and of recent, with all that's going on with COVID, we had some great expert talks revolving COVID, and then even in thoracic surgery, achalasia. So we get topics covering cardiac surgery, thoracic surgery, congenital, and it could be non-specific. It could be education, it could be based on how to be academically productive, um, access to practice and being a junior, attending. All these different advice comes together. We have a total of 106 tracks so far, and we usually average around 50,000 listens annually. This is the past couple of weeks, going into April. Some days we'll have 300 listens or more, so it's actually been pretty fun. This is kind of repeating the same thing that we just mentioned so far. So we typically add about 1 to 2 podcasts per month, and we'll keep that going over the next several years. And the methods in which you're able to find these contents are on SoundCloud, which is an app, and it has a website, or also on the Apple podcasting. We have it available there. We also have Thoracic Surgery Res Association question bank. And this was actually taken today. We have so far 259 candidates who have subscribed, who are active users. This graph here is showing the number of exams that some people are taking in a day, some more than others. And we make it absolutely free and available for residents. This is kind of our goal. We want to make sure that the resources that we have can go to those who need them. So if you're not able to get other resources, we still want to make sure that our specialty will not suffer, and that we can essentially continue to attract the best and the brightest to stay academically on par. There's 4 disciplines with the TSRA multiple choice question bank: cardiac, thoracic, congenital, and trauma. And each of those have another additional 5 to 10 sub-subjects in which there are at least 10 questions in each of those subjects. And it totals nearly around 600 questions. I do serve currently as the manager, so to speak, for the TSRA multiple choice question bank. And if there's any concerns or errors, I'm able to actually change that question right then and there. It's one of the features in being able to manage it myself that I found very useful. I've made edits so far to 44 questions. The goal is that everybody is able to contribute. As you do a question and you think things have changed, it's no longer accurate, from what it was this year versus last year, or whenever there's an update to the guidelines and whatnot, we can stay on par. So it is essentially a live question bank. I added a new resource to the question bank that makes it such that you can actually randomize the questions. You can do as few or as many as you would like. So there's test mode, there's practice mode. You can do 5 questions. You can do 100 questions straight. You can do it over 1 or 2 topics, or you can do it over less. And I think it's been pretty useful of recent. So that's the TSRA question bank, kind of in a nutshell. This is a picture. It's technically called the Fred software. So it's similar to when you have your standardized exam. Like, this is pretty much it. It is authentic in appearance. The questions present as they are there. You have your multiple choice. You can save. You can pause. You can do the test again. It essentially is the real feel of when you sit down for these examinations, this exam here. Of recent, I want to say that over the past year, we've been adding what's called a literature review. Our ultimate goal is to be able to have seminal work in our field available so that you can plan your journal club, so that you can say, hey, I wonder, what is the citation, or what is the knowledge behind why it is that we do what we do? Coronary artery bypass, where's the IMA seminal article that speaks to it. This website, which is the TSRA litreview.com website, kind of puts that together. So if you were to choose one of them in particular, say you choose congenital heart surgery, you'll see a couple of literature reviews that we put together so far regarding the field itself, and this is true for all three of the subspecialties. You'll see a breakdown of different topics. And I also want to say, similar to the question bank, it is alive. If you look at it today versus tomorrow versus next month, it will be different. We are continuing to add to the literature reviews as we come, and we are actually taking participants. So on the left-hand side, you can choose to submit a summary, and that summary will essentially be added. We have a method in which we go through the content and make sure that it is correct information, and we'll add that to our listing. We can continue to populate this. So as you guys join in this blog style seminal work review, you guys can be contributors, and your names will be populated on the links themselves as well. But what you'll also notice is that as we continue to create a lot of resources, we don't want to have a situation in which there's so many resources we can't keep control of it, or it's very difficult for individuals to navigate what to use and when. So on the left side, you'll see that there is a link to the TSRA question bank. So if you don't have that link, or you can't find the previous link, well, you can go to our literature review and you'll see that things are tied in together. You can click that link there, and that will help you get an account if you don't have one already, or you can just use that to log into the question bank directly. There's also links to our Facebook, where you can see the latest and greatest that we're putting up. We have newsletters that are coming out, and those newsletters are very useful. Alex will speak more on it as he currently manages to put that together. It's a great job that he's doing in that regard. But you'll have different dates of when different manuscripts are being accepted for publication, and different opportunities specific to our field as residents. We also have a link to our Twitter specifically from the TSRA Lit Review website as well. So it's kind of putting everything together so you can do less work and not have to memorize any of these specific details. Some of our major publications, or things that we've been able to put together, is our textbook consortium. I would say so far we have put together a great deal of textbooks, and again, these topics have been created with resident input with attending partnership. So every chapter that is put in by a resident has their expert attending as a participant, and we use that in our publication. One of the more recent ones that we've completed is the TSRA decision algorithms, which right now, actually all of the 5 textbooks that we have right now that are on Amazon and Kindle are in the cardiothoracic surgery. They are bestsellers. Right now we have a number 7 and number 8, as you can see, which is the TSRA decision algorithms and our TSRA clinical scenarios. And by the way, we are updating our TSRA clinical scenarios. There will be a new version of that coming out next month. So we're very happy about the work that we've been able to do in that regard. Specifically speaking on the TSRA decision algorithms, just to quickly talk about that, it's essentially a 100-chapter compendium. It is a derivative of a safe method to do a certain procedure or the management of a certain pathology in all 3 of the subspecialties: cardiac, thoracic, and congenital. Each decision algorithm is the method in which an attending has put together with help of a resident of how they would manage it. And again, with all of the topics that we're putting together, there are more than one ways to skin a cat. Our goal is not to be inexhaustive. Our goal is to say, hey, if you're questioning how do I manage a certain pathology, well, then this textbook will help you have a safe method. And again, you can find all of these resources on Amazon. Our ultimate goal is to make these affordable. So notice you'll never see any of our resources, a cost of $200 or more. We price it in such a way that residents can afford it. We also create some resources that are absolutely free, and they're based on our TSRA net website .org. We have the TSRA Pocket Mentor, and that resource serves as a guide. It's written by residents, faculty, program directors. It essentially covers an array of topics that are essentially not found in textbook. You know, how do I find time to read? How do I hone my technical skills? What is the method in which I can approach and find a mentor? How about conducting research? And some of these things are useful for even international residents, where you can kind of use some of these details to speak to the faculty that are here in the States or otherwise in your local area, and try to use that to expound on your early career success. We have the TSRA Intern Survival Guide, and that's also a valuable resource. It is helpful, and it helps to remain filling the gaps of knowledge and skills. And for our junior individuals of the field, you know, how to manage hypertension, hypotension, chest pain, low urine output, the different common bedside procedures. This puts a survival guide in place so that you can have quick answers to some of those things. I'm going back on some of the textbooks that we've created. The TSRA review of cardiothoracic surgery, we're very proud of. It essentially is, again, of all of our three subspecialties, cardiac, thoracic, and congenital, a summary of the critical information. And it's not exhaustive. It's not built to be a 300-page review of a topic, but essentially gives you a review. So as you're reading the exhaustive textbooks, you know, the Cone's Principles of Surgery, I'm going through, you know, the Shields of Thoracic Surgery, the 2-volume edition textbooks, you can then look at these TSRA reviews, and it can keep in your mind some of the broad review topics, so you can organize it in your head, and it can essentially be able to come out as you try to review the critical information that is out there. We also have a TSRA primer, which I think is also similarly useful for the junior members of cardiothoracic surgery residents. It is different because it's interactive. So on iTunes, it's available now. You can get the TSRA primer, and each chapter has essentially videos that you can look at. There are pictures as to like bypass setup, getting on pump safely. It's tailored to the young stage of learning cardiothoracic surgery. There's the clinical scenarios, which I mentioned we are having a 3rd edition that will be coming out next month. But it itself goes over the differentials, history, physical tests, the index scenarios, the treatments, management, the operative steps. It's the closest thing to going through a scenario in your head so that you can have the pearls and the pitfalls of different pathologies ready to go. They go through alternative scenarios and potential opportunities for you to intervene and salvage a certain procedure that's not going a certain way, to begin to resuscitate, to know when there is a concern. You know, you're doing a procedure and patient has VFib. You're not in the chest yet. You know, what are some of the things you should be thinking about? You know, setting up bypass and doing a procedure where you now want to give cardioplegia, but you have severe aortic regurgitation. What are going to be your plan, you know, moving forward? This helps you to bring those things to light, where you review the common high yield principles. Then there's the TSRA operative dictations in cardiothoracic surgery, which goes over the procedures so that you are able to talk and expound in regards to the descriptions of how you conduct an operation from start to finish. And that's also pretty exhaustive of all three specialties: cardiac, thoracic, and congenital. And again, the TSRA clinical scenarios, stay tuned. That's coming out next month, June 2020. But we also are looking at having a video resources that will be coming soon as well. So you stay tuned. And those websites that we shown are essentially the methods in which you can find all of our resources. And that's pretty much it. I thank you for your time and for listening to some of the projects that we are doing.